This is Gregor. And this is Zuleika. Ever since their first meeting and encounter, the scene has been living rent-free in Gregor's mind. He has been thinking about her every single day. And everywhere he goes, and every person in the room looks like her. Knowing that he couldn't contain himself anymore, Gregor finally approaches Zuleika and proposed. And just as Gregor, Zuleika has no hesitations. Being both doctors, they decided to run some tests before the marriage, and shockingly, both of them are thalassemia minor. Being aware of the risk, they discussed the consequences they might face if they continue with the marriage. After hours of discussions, they finally made up a decision, which is to break it off.
Hope you guys enjoyed our short skit. Moving on, now I will be talking about thalassemia. Some of you might be wondering, what is thalassemia? Thalassemia is an inherited blood disorder that affects the production of hemoglobin in an infected individual's body. There are two types of thalassemia, which are alpha thalassemia and beta thalassemia. The difference between these two is that alpha thalassemia results from a mutation or deletion in the genes that code for the alpha globin chains, while beta thalassemia results from mutations in the genes that code for beta globin chains. The symptoms of thalassemia includes abdominal swelling, facial bone deformities, dark urine, slow growth, fatigue, pale or yellowish skin, weakness, and mild anemia. Some individuals can even show no symptoms or asymptomatic. Next, I will be explaining how thalassemia can be inherited. Thalassemia is an inherited autosomal recessive condition, meaning that an individual can only inherit the disease if they possess two of the recessive alleles. Let's take a look at this Punnett square diagram. For individuals that are affected with severe thalassemia will be represented with a genotype of 2T. For thalassemia carrier, the genotype is represented with a capital T and a capital N, and for those that are unaffected or normal will be represented with 2N. In this example given, the parents are both heterozygous, and when we conduct the genetic crossing, we are able to see that the percentage of the offspring inheriting the disease is 25%, 50% probability of the offspring being a thalassemia carrier, and 25% probability of the offspring being normal.
I'm Shini, and I will be narrating the impact and treatments for the affected individual. Living with thalassemia isn't easy. Employees often need to take time off work for the frequent medical checkups and appointments. But here's the catch. Employees may not be well aware, and leading to the misconception of laziness. School children face similar challenges, missing classes for necessary appointments, and fatigue, especially after blood transfusion, will impede the memories and concentration, furthering affecting the learning progresses of these children. Moreover, life with long-term illness can cast shadows on one's mental well-being. Uncertainty ahead can breed anxiety. And in cases of thalassemia, study reveals children facing elevated levels of depression, as daily treatments serve as a constant companion, subtly reminding one of their battle. Besides that, the weariness and symptoms often comes as silent barriers, hindering social connections and straining relationships. The path of family planning involves seeking understanding and support, unraveling the levels of uncertainty and building resilience. In the face of challenges, A community of understanding can be the brightest beacon, as when employers is well informed, they can help them to accommodate the special demands such as offering flexible work hours and modifying their duties. Moreover, if a school personnel is well informed of the illness, they could address the special needs of the children by providing more time for tasks, notes for missing lessons, and tools for home studies such as tablets. Moreover, it is important for an individual to ask for help and seek advice from medical professionals, which allows them to express their wants and difficulties and help them to reduce the psychological anxiety and tensions. Moreover, they could learn relaxation techniques such as breathing exercise and meditation. It is also crucial for the individual with the carrier genes to have genetic counseling, which helps to assist the couple in considering of some concerns connecting to passing thalassemia to their offspring and determining the risk factor. A woman with severe thalassemia can also give birth safely, requires additional cardiac monitoring. If a couple decided to have offspring, they could seek for fertility treatments. And last but not least, medical treatments such as blood transfusion will be needed for severe form of thalassemia. However, this will lead to a build-up of iron in the blood, which will damage the vital organs. Hence, chelation therapy and oral medication came in place to remove the excess ions in the blood. Next, stem cells transplant might be an option for some cases, such as children with severe thalassemia. With that, I will be passing it to Asalena to discuss with you guys on the impact and ways to help out a family member of a thalassemia patient.
There are 4 major impacts of this thalassemia to the family, which are high cost of treatment, lack of social support, lack of effective treatments, and also being isolated. The first one, which is the high cost of treatment, this massive burden is caused by the medical costs such as medicine, the frequent blood transfusion, and also iron chelation therapy that are critical for the patient that are facing thalassemia. The second one is the lack of social support. As we all know, most people are still not aware of this disease and furthermore understanding it. This can be seen more prevalent in Iran, where there are false beliefs and superstitions due to cultural belief and lack of knowledge about this disease. Thus, the family will feel unsupported since no one else knows what they're going through. And in the long run, these families might deal with mental health problems such as anxiety or depression. The third one, which is the lack of effective treatment. Most of the severe form of thalassemia often requires frequent blood transfusion, possibly every few weeks. But over time, this method and this treatment will cause the build-up of iron in the patient's body, which then will lead them to need the other therapy, which is the chelation therapy, where the excess iron will be removed. The last one is the being isolated from other people. As I mentioned earlier, there are still not many people that are aware of this disease, and we can see in the Middle East, parents suffer both mentally and physically because of this thalassemia disease. Thus, this parent and family who are dealing with thalassemia tend to conceal the disease, which leads them to being isolated from the society. So, the treatment and ways to help the family, there are 3 treatment and ways. The first one, which is the holistic nursing interventions, it helps to give the support needed by the parents and the family members. And other than that, this will motivate these people to cope with the stress and burden they face. With this intervention, the family members or the parents can share what they went through, and this can lessen their burdens. The second one, the financial support, is very crucial for the family as it will lessen the burden and the worry of the parents. It will also make sure the children or the family member that is affected to get the treatment that they need. For the last one, which is the educational and awareness program, this is also very crucial to raise awareness among the close family, friends, and community plays extremely important parts for the social support, because when more people knows about this disease and more people understand about it, thus there will be more hands and more bodies to help motivate and also give support to this family so that they will not feel alone in this battle.